We're an over 800-bed hospital. We have an ambulatory surgery center. We have 3 infusion centers. We have a freestanding emergency room, 3 retail pharmacies throughout town. So we have experienced a dramatic amount of growth over the last 2 years. There were a couple of differentiators with Pyxis ES that really made us go in that direction. Moving to ES and being able to link to Active Directory made a world of difference.
Active Directory streamlined our process, so now we don't have to worry about usernames and making sure that's correct, and allows us to focus on what we need to really worry about is we grant the access, whether it be a nurse, a pharmacist, a technician.
Before, it seems like we had to make a lot of phone calls to pharmacy and to IS and everything, and now it's just simply when the nurse is onboarded and they go through training, they get access to Cerner, and they're automatically able to get into the Pyxis without all the phone calls.
And we also have the security and peace of mind of knowing that when an employee leaves, when their access in Active Directory is terminated, their access in Pyxis is terminated. One of the other main drivers was the formulary interface.
Building a formulary is timely and cumbersome. However, once we have it in place, it's very, very easy to use and really kind of drives it for you.
So with the formulary interface, we were able to ensure that our EMR database matched up with what's in our Pyxis database. And so drugs, when added to the EMR, flow over directly to Pyxis, and we just have to make a few minor tweaks and they're in the formulary.
Having the server more centralized in the IT server area makes it more robust, it makes it more efficient. It allows them to do server-level backups types of things.
Just from a disaster management standpoint, having the ability to put the server in our IT data center, that was a big deal.
Since we have sites that are not located in one main campus, the remote access, now that it's web-based, has been huge because we have staff throughout the city and we have devices in some places where we don't have staff.
We want to give the nurses more efficient tools to do their job better.
When you pull up your patient's name and you type in medication cart, we can pull up the patient's room number and pull out their medications out of the drawer. You're safeguarded against same names. You're safeguarded with the medications in the medication carts that are available in the Pyxis machine.
We went with the full med dispense or a cartless system. And so we're up to about 89% of all meds being in Pyxis, and that includes IV piggybacks and all injectables, everything basically. We're looking at ES Link to give the nurses the ability to access the Pyxis away from the Pyxis machine. So in our areas where we have a high bed to Pyxis ratio, where there's a lot of stacking at the Pyxis machine, we feel like we're going to gain some efficiencies when nurses can continue to spin up their meds instead of having to wait till the other nurse to finish, and then they can just walk up and get their meds out by pressing a button. We see what the future has to offer, and there's a lot of potential here with expanding into other systems and interoperability and integration.
We are at the main campus, we're very decentralized. We have staff on the floors. They're utilizing a clinical staff model, whereas the pharmacist not only enters orders, but also participates in the clinical rounding process. So that interaction allows them to participate in the healthcare process. Our Lady Lake has taken on the role of wanting to be on the forefront of technology. So it really made sense for us to go to ES.